policy on HIV and TB and ART. Thank you. Take it away.
Thank you, Ruben. Good afternoon. Today I'm going to present a review of global policy that highlights the role of treatment as prevention for HIV-associated TB. This presentation will summarize the national guidelines on ART and the 3 I's for HIV-TB, along with the status of implementation of the national recommendations. So as we all know, there is considerable evidence and interest in expanding ART for prevention of HIV and TB morbidity, mortality, and transmission. A recent meta-analysis showed that ART decreases the risk of developing TB by 65% across all CD4 counts. There's a potential for additional impact of IPT, which reduces the risk of developing TB by 33%. WHO recommends to decrease the burden of TB in people living with HIV. WHO recommends the 3 I's for HIV-TB, which includes intensified TB case finding, isoniazid preventive therapy, and earlier ART at CD4 count less than 350, and TB infection control. The WHO guidelines further recommend a 4-symptom screening algorithm to screen for TB, and those found asymptomatic are recommended IPT for a minimum of 6 months. So this slide describes our methodology. From various sources, we collected a total of 113 guidelines from 72 countries. Using a standard abstraction form, we reviewed recommendations on ART eligibility criteria for asymptomatic people for all the countries and recommendation on the 3 I's for HIV-TB for the low-income countries. Let's first look at when to start ART for prevention of TB. A total of 45 of the 72 countries are consistent with WHO guidelines and recommend ART at CD4 count less than 350. As earlier ART prevents TB and other co-infections, WHO, the 10 countries that have revised their guidelines and now recommend ART above 350 CD4 count. Even though majority of the countries are recommending ART at less than 350, we find that more than 57 countries have an ART coverage rate of less than 80% in 2011. And these include the countries which have the highest burden of HIV and TB. We found a total of 51 low-income countries to have guidelines on the 3 I's. 43 of these countries recommend intensified TB case finding. Home-based screening is recommended in 3 countries, Afghanistan, Kenya, and Ghana. Let's move on to the IPT-related recommendations. So a total of 39 countries recommend a minimum of 6 months of IPT. So we've categorized these countries according to the TB exclusion criteria followed by them. 9 countries are consistent with the WHO guidelines and recommend the 4-symptom screening algorithm. In 10 countries, other symptoms are also recommended to exclude active TB. If you look at the global progress, between 2005 and 2011, there has been a gradual progress in providing people with ICF and IPT. At the end of 2011, 3.2 million people were screened for TB, and 450,000 adults and children were provided with IPT. But in 2011, less than 1% of the 34 million people living with HIV received TB screening. If you look at the status of implementation of IPT, the status, IPT is very limited in at least 12 of the 39 countries that recommend it. Some of these countries are having pilot programs, as described by the red dots here, to scale up IPT. Even some countries that do not recommend IPT are having pilot programs to determine its feasibility. A total of 24 countries have various administrative, environmental, and personal protective measures for TB infection control. Our review has few limitations. We looked at the published guidelines, which are dynamically changing, and they may not reflect actual practice or implementation. While some countries are very slow on implementing their recommendations, we know some countries have adopted earlier ART. So in summary, we found that majority of countries are consistent with WHO guidelines and recommend ART at less than 350. Some of the countries are even recommending earlier ART. Also, countries are adopting IPT for TB prevention. But there are many countries in the high burden areas which are not consistent with the WHO guidelines on ART or TB prevention. So increased efforts are needed to accelerate implementation of interventions for TB prevention. Thank you so much.
Thank you very much. So we'll take questions afterward.